worked at this hospital for 25 years, and that nurse's station has been the same in the emergency department. And when I started, we saw very few patients, maybe 7 a day, and now we see between 35 and 50 a day, and it's the same size nurse's station. So to have a new nurse's station will be nice, good for the morale. Now our emergency room and our our administration areas are really far apart and quite separated, and so we're going to bring them together so it's an easier transition for the patients and the staff. Now the patients come in through the main entrance. The first people they present to is the administration staff, and then they present their problem to the administration staff, they register, then they walk down a very long corridor, which is about 200 feet, to the emergency room, present to the nurses with their problem, and then our triage. So if you come with chest pain, you ultimately there's a long period of time between where you're seen by the administration staff and then seen by the nurse. Right now, our triage room is 50 feet away. If I'm in here triaging a patient, I'm secluded. There's 2 safety issues with that. 1, I'm secluded in a room with a patient that I know nothing about. And 2, I'm far away from my colleagues. So if I'm needed in the emergency department, they either have to phone me, hit my voice Sarah, and then I have to run if they need me, and same with if I need them. And it's going to be a nice big waiting room with windows, as opposed to the small little closet we have now that's very dark. So a nice big waiting room with slightly more comfortable chairs, ergonomically correct chairs for the patients, and the staff will have access, visual contact with the patients at all time while they're in the waiting room.
Enhancements to the nursing station. The physicians and nurses were really clear that this is something that's very close to their hearts. So we're extremely grateful for that. It's going to provide a lot of confidentiality and efficiencies for the staff and the physicians especially. Really excited to have another bathroom that people can use when they're waiting, and then that other one will be maintained and more for use for people who are actually in the department. In the triage room, we have plans for 2 types of medical gases, so piped in oxygen and compressed room air.
I've worked for this hospital a long time. I'm very proud of this little hospital. It is a very small hospital, but we do amazing things here. I think it's great for such a small community to communities, Oliver and Oceas, to have a hospital and be able to have the emergency department we do and have access to the care that we have. We have a lot of traumas in the summer, and I think that it says a lot for the 2 communities how much they are engaged with the hospital in order to donate money and feel the need to have money donated to continue to have access to care, and I think it's great.